serving as chair of the King County Board of Health, calling our regular meeting for Thursday, June 18th to order. Madam Clerk, would you be kind enough to please call the roll?
Thank you, Mr. Chair. Board Member Cole-Wells. Board Member Lambert.
Here.
Board Member Dembowski.
Here, pending Councilmember Cole-Wells' arrival.
Thank you. Board Member Lewis. Board Member Lewis. I'm going to assist and unmute here. Board Member Morales. Board Member Mosqueda.
Here.
Board Member Baker. Board Member Honda. Board Member Zahn.
Here.
Board Member Daniel.
Here.
Board Member DeLucky.
Here.
Mr. Chair.
Here.
You have a quorum, Mr. Chair.
And we have Lewis and Morales recorded as present.
I don't, but I believe they are on the call.
Board Member, if you are able to unmute Board Member Lewis and Board Member Morales.
Yes, this is Councilmember Morales. I'm here. My apologies.
Thank you.
Thank you. And as we begin today, I'd like to acknowledge that we're on the traditional lands of the Puget Salish peoples, past and present. We'd like to thank the caretakers of the land who have lived here and continue to live here since time immemorial. I'd also like to acknowledge the contributions of many urban Indians in King County who have brought their cultural ways of life here and greatly enrich our community. Madam Clerk, are there alternates serving in place of regular members?
I'm not aware of any, although it sounds like Councilmember Dembowski might be.
Councilmember Dembowski is indeed seated as a voting member in the absence of Councilmember Cole-Wells.
And also Councilmember Zahn will be serving in place of Councilmember Baker. Or Mayor Baker.
Thank you.
Excuse me, this is Susan Honda.
Hi,
Thank you.
And I'm on the phone. I can't get into my Zoom right now, so I'll keep working, but at this point I'm on the phone.
I will rename you so we can identify you on the call.
We've got you. We've got you now.
Okay, thank you.
Thank you. That takes us to public comment. And as we enter public comment on our agenda, I want to be sure that everyone who is called in understands how the process will be managed. As all members of the public join the meeting, they were automatically muted, and we can see either the name, if you've assigned one in Zoom, or the last 3 digits of your telephone number. Our clerk will call the names and numbers. When your name or the last 3 digits of your phone number is called, staff will unmute your line. Please make sure that you also unmute your phone or computer if you have muted yourself as a courtesy. Before you begin your testimony, please wait to be acknowledged, perhaps by saying your name, so that we can confirm that we hear you. And then once confirmed, if you would begin by saying and spelling your name so we can have it accurate for the record. You will then have 2 minutes to speak, and you should hear a timer go off when you've reached 2 minutes. You can certainly finish your thought, but if you please wrap up your comments to allow the next person to speak. If you go much past 2 minutes, you will be muted. If you're listening on the TV or streaming, I ask you to please mute that sound when you're testifying to prevent feedback. Please hang up after you've provided your comments to make it easier for us to manage the call. You can follow the remainder of the meeting on King County Television, channel 22, or to stream online. The link to the online streaming is at the King County Council's website, which is www.kingcounty.gov/council, and click on the Watch Us Live button. We will now begin the public comment. Reminder to when your name or number is called to unmute yourself and then say your name so we can confirm that we hear you. With that, Madam Clerk, would you please call people for public comment.
Thank you, Mr. Chair. The first person on the line is the last three digits, 235. Please go ahead. Would you like to give public testimony? Last three digits, 235. Next phone on the list is last three digits, 371. Please go ahead if you'd like to give public testimony. You are unmuted, 371. Next number on the list is last three digits, 554. Please go ahead if you'd like to give public testimony. Next number on the list is last three digits, 583. You're unmuted. Next number on the list is, yes?
Madam Clerk, I don't know if you remuted 583, but 583 is muted now when I see the 583.
Is gone now.
Okay.
Hi, this is Dolores, Public Health Nursing.
Oh. We can hear you, Dolores. Please introduce yourself.
Hi, my name is Dolores Mack. I'm a public health nurse. I was hired to be the PHN at the Midway Clinic in Des Moines, but I've been deployed to the COVID-19 Isolation Quarantine Center in Kent, Washington.
Please, and you're here to provide public comment. Please proceed. Dolores, were you here to provide public comment to the Board of Health? If so, please proceed.
Hi, sorry about that. Thank you. I just wanted to say that I'm really proud of what the county is doing with offering the isolation and quarantine site for those who don't have opportunities to safely isolate or quarantine at home or other places. I've been at this site since March of 2020, and I definitely see a lot of good work here, so I definitely appreciate what the county has done. So thank you.
Thank you.
Next number on the list is last three digits, 235. If you'd like to give public testimony, you are now unmuted. Next number on the list is last three digits, 633. If you'd like to give public testimony, you're unmuted now.
Wonderful. Good afternoon. My name is Kate Lang Perez. Can you hear me?
Yes.
Perfect. I'm a Seattle-based public health professional, and I want to start by acknowledging King County's declaration of racism as a public health crisis. It is an accomplishment made possible only by decades of Black-led anti-racist organizing. As the board discusses its own adoption of a declaration today, it's imperative that as public health professionals, we also declare police violence as a public health emergency. Police violence maintains systematic racism through social control of marginalized populations. And to more courageously address racism, we must address the violence of policing as an institution upholding the system of racism. And there's clear public health guidance to do so. The Board of Health has a responsibility to create a resolution that has clear, actionable recommendations for King County decision makers. Public health evidence demonstrates the effectiveness of addressing the social determinants of health by investing in community-led initiatives for health, harm reduction, and safety. The American Public Health Association recommends using resources from law enforcement to this end. I ask the board recommend diverting at least 50% of law enforcement funding across the county to such community-led initiatives. I strongly urge the board to amplify these actionable recommendations from Black-led and Indigenous-led community organizers, and these recommendations are grounded in the social determinants of health and can help the board hold other decision makers accountable to truly creating health equity and social justice in King County. Thank you.
Thank you. Next number on the list is 235. You are unmuted if you'd like to give public testimony. Next number on the list is 171. You are unmuted if you'd like to give public testimony.
Oh, good afternoon. Can you hear me?
I can.
Okay, this is Juliana Alson. It's JuliannaAlson. I'm a Seattle-based public health professional. I'd also like to commend you for your action today declaring racism as a public health crisis. Most of all, I want to commend the many organizing campaigns led by Black organizers who made this possible. I'd also like to ask you to please go further and urgently. If we're going to talk about racism as a system of harm, we need to talk about the institutions that uphold it. As public health professionals, we all know that we need to identify the mechanisms through which adverse health effects occur, and we need to look as upstream as possible. And in this case, when we're looking upstream, we see policing as an institution, one that's founded on the social control of marginalized populations and acts as a determinant of equity. I don't think anyone, including yourselves, are debating at this point that police violence is a public health crisis with disproportionate impact on the physical and psychological health of Black people, but the data are available should you need them. Only if we're bold enough to actually examine this mechanism of harm can we create effective interventions. We can't hold systems accountable, but we can hold actors and institutions accountable when we make clear guidelines. We need you all to take courageous public health leadership and set the tone and expectations for decision makers in King County. We need you to boldly state this knowledge and align guidelines and regulations with the calls coming from communities most impacted by police violence. We currently have real solutions being proposed by Black-led organizing collectives, Indigenous communities, people of color, homeless individuals, and young people. We have people who are inside our prisons and jails calling for these same solutions. The Decriminalize Seattle Coalition, for example, is calling to defund bloated law enforcement budgets by at least 50%, calling to reallocate resources to community-led solutions that fund the social determinants of health. Resource reallocation might also include transfer of underutilized land to Black communities, as King County Expo is calling for. Our neighbors living in tent cities and tiny house villages have long been calling to decriminalize formal encampment. I'll just end by saying that luckily our professional association has guidance for that. The APHA has clear action steps for all levels of government, and we need your leadership, your courageous leadership, to adopt similar guidelines and recommendations so that we can address police violence now. Thank you.
Thank you. Next number on the list is last three digits, 196. You are unmuted if you'd like to give public testimony. Next number on the list is last three digits, 235. Please go ahead if you'd like to give public testimony. Next number is 171. You are unmuted. Please go ahead if you'd like to give public testimony.
This is Juliana again. I just spoke.
Oh, Sorry. Next number is last three digits, 790. You are unmuted.
Good afternoon. Can you hear me?
I can.
Hello, everyone. My name is Omid Bagheri. Viragani, OMIDBAGHERIGARAKANI. I'm a Seattle resident over 12 years. I'm here today as a public health worker, faculty at the UW School of Public Health, and co-author of the American Public Health Association policy resolution focused on police violence. We as public health practitioners are byproducts of the racist environment of which we exist. The often cited social determinants of health are byproducts of systemic oppression. This is why our primary goal within public health work is to disrupt, to counter, to structurally change the systems, and not seek to simply change the behavior of people for the racism that they're exposed to. I'm in support of the resolution today. I want to urge this board to take the next step in the weeks ahead to build on this resolution and advocate for health justice, truly prioritizing health and well-being above all else. You know, we are not at this juncture today out of happenstance. We're at this moment today because the system of policing has continued to murder members of our own community, the Black community, Indigenous community, communities of color, other groups whose health is harmed by policing, such as people experiencing homelessness and people with disabilities. The physical, psychological harm is only compounded by being a member of several of these groups, which is the case in our county. And this is what I mean by we must name the specific systems that are creating this crisis in a public health emergency. Today, countless institutions have now cited the American Public Health Association statement. Of those locally who have used the statement, the deans of health sciences of all the University of Washington schools, Harvard Injury Prevention Research Center, and of course, 10,000 healthcare and public health workers march in alignment with these policy guidelines in downtown Seattle, focused on police violence recently. Our community has defined the problem. They have crafted solutions on the use of police, on the use of youth jails. And this board knows, and as this board knows, have made various demands on how our public resources can be better used and instead invested in the public health evidence. Reallocating money from policing towards community-led health safety strategies, towards meeting human need, land ownership in the Central District for Black communities have been pushed out. This is a public health approach. I will submit my comments here as written comments, and I'll just end that I want to make myself available to work with this board in any way I can to advance the health justice I know we all seek. Thank you for your time.
Thank you.
The last number on the list is last three digits, 103. You're unmuted. Mr. Chair, that completes my list.
Madam Clerk, to ensure that everyone who would like to testify has had the opportunity, I would ask in a moment that you unmute everyone. And within that, it might be chaotic, but if you are on the line and want to testify and did not unmute in time or were not able to just now, will you please say your name? And I'll get a list and we'll call everybody as might be necessary. So you should be now unmuted. If you're interested in offering public testimony and have not done so, will you please say your name?
I was just going to ask you if you push.
Yep. Okay, got one.
I'm hearing no one. I'm hearing no one. And so, Madam Clerk, I thank you for that. And ask, and we'll close. There we go. We'll close public comment and proceed. The next item on the agenda is the chair's report. I want to welcome everyone to our regular June meeting. Our agenda today focuses on one item, considering a resolution declaring racism as a public health crisis. When we last gathered, just about 70 hours ago, we had a robust conversation that covered the effects of racism on health and well-being, how racism can be carried out and carried forward through institutional policies and procedures, and the role of the King County Board of Health in addressing racism. I look forward to continuing that conversation with you today. I would like to address some unfinished board business. As you know, the board adopts a work plan each year. I had intended to bring forward the plan at our March meeting, but because of the stay home, stay healthy order and our inability to meet at the time, that did not happen. In the time since that work plan was drafted, both the COVID-19 response and addressing racism throughout our society, and particularly as a public health crisis, have captured the national and local consciousness. We've also lost 4 months of our work time would have been part of that work plan. So not only do we have more and perhaps a broader body of work than we might have considered in March, but we have less time in the calendar year to do it. I propose that our work plan should be revised with a specific lens of supporting the COVID-19 response and addressing racism generally, but specifically as a public health crisis. I expect the board will work on other items, taking action to meet required deadlines and other vital topics. But my initial recommendation is that we focus our limited time this year to these important topics. I will have a written draft work plan for consideration at our July board meeting, which you will all receive in advance. With that concludes the chair's report, and I would introduce Director Patty Hayes, the director of the Seattle-King County Department of Public Health, for the direct report.
Thank you, Mr. Chair, and hello, board members. Grateful to be with you all today. I don't have my video on. A week ago today, I had some surgery, so I am just keeping my video off for another few days, and really appreciate everybody's warm thoughts while I was recovering. I'm doing very well. I do want to say how grateful I am to have the board having this conversation today, and really appreciate the public comment we've heard around racism as a public health crisis and the place we all need to stand in this space to move systems and change our country right now and to a new place. And I look forward to that. Mr. Chair, I'm going to keep my report brief. First, we submitted our application for phase 2, as the board knows, by your action. We're still waiting to hear about that. I'm thinking that we will hear back from the state tomorrow, and I'm hopeful that that will be a positive move into phase 2. So watch for that announcement. On a couple of COVID updates, in terms of testing, we have seen a large increase in testing across the county with some great partnerships that I wanted to highlight just a couple. We're really working to ensure that anyone who is symptomatic seeks testing quickly, getting those messages out, and that most of our testing is done through our primary care partners and providers. But we've been working to make sure we have what we're calling open access sites available for individuals who are uninsured, underinsured, or are having trouble finding a place to be tested. We focused on areas both with high case numbers and in areas of high need around the county. And as you've heard, the City of Seattle has partnered also independently to establish some options within the city, which has been a tremendous asset. One of the ones I want to identify today and give a shout out is that this last weekend, we had a partnership with Tina Knowles Lawson of I Did My Part campaign and Beyonce's Be Good initiative, who worked with the health department and other local organizations to provide free drive-through testing in the South End, as well as free essential supplies and care packages to the community. The testing was done by Public Health Seattle-King County. It was conducted in partnership with CMAR Community Health Center, Health Point Health Center, and Harborview Medical Center. The Somali Health Board was the leading community organization driving the work with over 30 community organizations supporting it. We're so grateful to all the hard work, and I'm delighted to say that over the course of the 2 days, over 1,200 COVID tests were done and provided face coverings and care packages to over 3,500 individuals and families. On-site interpretation services in over 25 languages and written materials were done in this. I think it's a stellar example of the work we can do together. I'm just, again, want to give a shout out to our partners. In addition, CMAR in Bellevue is beginning open access testing soon. That was a gap area we've been really knowing we needed to get access to testing. And we're working with a couple of the community health center partners for that area as well. And I also want to make sure you all are aware that Kroger is offering testing Tuesday, Wednesday, and Thursday at Bellevue College this month. And I think that it's great to have Kroger looking to see what they can do to participate. Lastly, another piece of really great news, and thanks to the board and to the board chair. I was notified day before yesterday that the State Board of Health is reopening their rules consideration for notifiable conditions to add a requirement for race and ethnicity to be identified. This was something that a couple of months ago I highlighted, and on behalf of the board chair sent a letter requesting that the State Board of Health open this up. This is an extremely important move that I'm very excited to see, because one of the requests from many community organizations is further disaggregation of data. It's a public health responsibility, but we are limited when we don't have the data. So this is a very positive move, and I look forward to when the hearing for this will come up later this summer to have the board presence participating somehow in that through letter, or possibly the chair participating in the rules hearing, as well as myself. So with that, Mr. Chair, I'll close my comments.
Thank you, Director Hayes. Are there questions for Patty? Board members on.
Yeah, I would say not necessarily a question. I just want to appreciate the fact that, we identified the gap in East King County about testing sites. And so this week with Bellevue College, and then hearing that collaborating with CMAR to provide the access to testing, because I think as the county reopens more fully, we're going to definitely need to make sure that we have that testing capability. So I really want to appreciate you closing that gap. So thank you.
Further questions? Board Member Mosqueda.
Thank you. Hi, Director Hayes. It's good to hear your voice. I hope you are doing well. I just wanted to also say thank you. And from our vantage point in Seattle, we have been able to, I think, because of the strong partnership with King County and Public Health Seattle King County, we've been able to talk to other cities about how to prepare in advance of this wave of COVID that was coming their way. And I just wanted to tell you how many cities have been reaching out to us because of the role that you all played in acting quickly. So thank you very much for showing the nation how it should be done. And our numbers, I know, remain relatively low or are maybe plateauing. If you could speak about sort of, again, what you think is on the horizon with phase 2 coming, and any concerns that you have about either us being at a plateau and not dipping, or a potential for increase, that would be helpful. And then the second question that I had is, if there's any conversation or policy that you think that the Board of Health could advance to help support get more folks who are unsheltered into hotels and motels as a temporary use, given the CDC's guidance or advice to do that. I've just been so proud to see how that's not only helped to stabilize folks and prevent people from getting COVID, but to really also help them, remain housed and not cycle back or be able to get into programs that they needed to be stabilized. So I guess those are my two questions, if you don't mind reiterating those.
Sure. Thank you, Board Member Mosqueda. Great to see you. I'll be back visual soon. In terms of phase 2, one thing that Dr. Duchin has said all along is that one of the goals with reopening is to do it in a way that we are doing it slowly and we are watching the metrics. And so I think we've been very successful at this. It's why I think the state will approve our phase 2 application, is that we are meeting the metric around the per 100,000 level that we're supposed to be hitting, which is less than 25. Our numbers were, they kind of go up and down on each day. Today, the first go, and I haven't looked at the afternoon, was a little bit higher. And some of this Dr. Duchin expects, because as we increase testing, we are going to see some increase in cases. But what we watch with that metric, and this is really different than what you hear happening in Florida and Texas and Arizona, is we are watching the capacity of the hospitals. If we see increased numbers, but we stay low in hospital utilization, which is exactly what's happening right now. Actually, the hospital utilization for COVID has continued to decline. So the really good news is, unlike these other states that have opened much quicker than we have, and they are seeing an uptick in cases, they're also seeing a huge uptick in hospitalizations. So that's why we look at these metrics together. And we're also going to see more outbreaks within employers, and we are adding question and tracking within our case and contact tracing so that we are being able to work with employers. And then we're watching to see folks who are at gatherings. Gatherings can be church gatherings. They can be the protests. There's many ways gatherings happen. And we want to watch that so we can put out more messaging. One of the things I think that each one of the board members can do right now that would be an opportune time this weekend. I know you all love doing selfie movies, right? You all know how to take pictures. So put your mask on and post on your personal Facebook or whatever social media you have your story of wearing your mask and how you're doing that to protect yourself, your family, and your community. This has been an extremely great strategy across the country in areas that are successful in using face coverings. And if each member of the Board of Health would do that for me, that would just, I hope it will be fun for you and it would really help. So the second question you had, Board Member Mosqueda, was around the housing and homelessness. I just want to say I'm so grateful that our partnership and strategy together seems to have been so successful. I want to knock on wood again. We only had one major outbreak within a shelter area, and we've been doing targeted testing and encampments in different places. We do have cases, but we don't have big outbreaks, and that was just such a blessing along the way, and I hope that will hold. The strategies around homelessness are clearly something the board can continue to talk about over time and work together on what's best in King County. I'm happy to bring in TJ Cosgrove and our other folks when we're ready for that conversation. So I don't have any policy right now, but clearly that is important in this outbreak and also for our community's health and well-being for those folks. So with that, thank you.
Lambert.
Councilmember Lambert, and then Cole Wells.
Thank you, Mr. Chair. First, Patty, thank you. And congratulations on your award from the University of Washington. It was fun to open the magazine and see you there in picture and all the nice things they said that are obviously well deserved. So congratulations. I hope you're feeling better. I want to piggyback with what Council Member Zahn said. The testing is really important. And on the list that have been put out from Public Health and others, they have not listed any sites beyond Bellevue. So half the landmass of the county didn't get listed at all. So I realize that there are fewer cases on that half of the county, but I think it should at least be listed so people know where they can go. And then also piggybacking on that, I continue to be, as you've heard before, very, very concerned that in the eastern part of this county, where some of the cities have had less than 5 cases, they have the strongest anti-business requirements. They started out at 15, hopefully will go to 30%. Everybody else started out at 25% to go to 50. But the small retail stores are left behind when they have the least cases. So I am very concerned about that disparity and really hope that there will be some changes even during phase 2 that can help our small businesses.
So thank you for the comment. And we are watching where testing is available. What's up on our website is the open access pieces. And I need to talk with Susie a bit about whether or not we should put up something that's more general around that, because I think your point's well taken. People don't always know that their provider should be available to them. Anyway, I am thinking about that. I appreciate you bringing it up. In terms of the governor's phases, it's clear right now that King County is not able to subdivide itself. And again, when you think about the virus, it moves between counties. So I can understand both the frustration when in a small area and the businesses are suffering so much. And also we know that the virus is going to show up all over the place. So if the board wanted to make a request to the governor to have a status change for certain parts of King County, that would be something the board could request. I don't have any idea if it would be possible within the phase to alter something. It's not something that we as a county or the board has the authority to change right now. So I know this has come up, and with CSA, on a call I was on, that was something that was discussed there as well. So I'll leave that for you and the chair to discuss, because if the board so wish to write a letter to the governor about the exception, that would be the board's prerogative for sure.
Mr. Chair.
Board member.
Thank you. I appreciate that suggestion. I definitely think that when you can go to, and I said box stores the other day, and somebody said to me, what's a box store? So to be clear, the bigger stores, the Costco's, the Staples, the Home Depots, all those things. People can go, you wait in line to get in, and many, many people can be in that store because they have lots of square footage. In parts of this county where the square footage of a very small store is very small, and now you can only use 15% of that, it is not equitable. It is not fair. And the people have the ability to keep 6 feet and to do what needs to be done, but they're hampered from having even 2 people in their store when you can go to a box store and have 100 people in there. And the inequity of that is very upsetting. And so the very thing we're talking about disparate treatment of people is happening here. And I think we need to be able to say to our littler stores and to our smaller communities who do not have high caseloads that we will help you by being able to say that you may open. The mayors have said they will take over the supervision so that we keep the disease down. We can clearly monitor if the disease outbreaks happen. But to say that you can't have 2 or 3 people in a store in, say, Carnation, but you can have 150 people in a store someplace else in the county is just not okay. So I would really like to see us write a letter to the governor saying, please be aware of the disparate impacts that this is having on small stores. Thank you, Mr. Chair.
Thank you. Board Member Cole-Wells.
Thank you, Mr. Chair. Patty, first of all, I'm glad you got through your surgery well and you're doing well. We need you, obviously. I have a follow-up question about your suggestion that we post our photos with our masks on Facebook. And wondered if that's something you were suggesting in an organized way, perhaps for all of us, and have photos, multiple photos on one Facebook post, or you're suggesting that in a more informal way, that we just do that on our own?
Well, I love that you're thinking very organized. My head doesn't get that organized quickly, and I don't have the technology smarts to know how you even do something so organized. But if you all want to do something like that and could get it done next week and get it posted as the board, that would be even cooler if the board staff could help organize that and maybe put some sort of jazzy music with it that you all would like. That would be, no, I will post that nationally if you guys do that, because nobody's done that. I think that would be so cool.
Well, great. And I just need someone to organize that and to tell me when the deadline is to get my photo in. Thank you.
Okay. Message received, Board Member Cole-Wells. The deadline is 5 p.m. on Monday. Email me at my King County email address a photo of every board member wearing their mask, and perhaps with a quote about why you wear a mask. And by the end of the week, we'll have something produced and out. Further questions for Director Hayes before we take on 3 more projects? We see you, Board Member Lambert. All right. Thank you, Patty.
Hey, Joe, can I just add one comment? I didn't want to go twice unless everyone was done.
Please go ahead.
To Councilmember Lambert's point, last week I brought up the fact that if you think about construction, the industry came together and came up with what safety requirements would look like so that all construction can commence as part of phase 2. And so to the degree that we can look at some state advocacy that says that if a business can demonstrate or the industry, whatever that is, whether it's retail, restaurants, can come up with those best practices that can safely open, I think that's maybe what Councilmember Lambert's talking about. And so there is a model already at the state level where an industry's done that. So to the degree that we can look at how they were able to do that and do that type of advocacy is perhaps one actionable approach we can take. Because I appreciate that. I think Councilmember Lambert's brought this up every time I've been in one of these meetings with her. And I just think that versus just talking about it, let's figure out what that strategy looks like.
Thank you.
I have a question.
Board Member Honda.
Thank you. So if our numbers were to go up and it was determined that we needed to move down a phase, let's say we were at phase 3 and the second wave hit and we needed to move down, how exactly would that work? Businesses would be ramped up to serve their customers. I've been asked by some businesses and I don't know how that would work.
So I think for right now, the way, if you get these questions, the best answer for folks is that it's really the intent and the understanding. And then you can see this around the country. It's really hard to go back. So our goal is that while we're doing this very slow opening and learning, we're building our contact tracing and our ability to contain the outbreaks so that we can continue to move in phases and manage. And again, if in the fall, Dr. Duchin's big concern is that when the flu season hits, if the flu is bad on top of COVID reemerging with a second wave, that it will overwhelm the hospitals. So I think it's, again, we have to build so that we can manage it, and the hospitals are ready for surge capacity so that we don't get to that point. Now, if we have to go back, I think that the governor is going to have to rethink the phased approach, because I don't think just bumping down arbitrarily, there's going to be schools open. There's so many things there. So there isn't a roadmap to give to anybody right now. So I think we need to acknowledge everybody's concern about that, have everybody supporting physical distancing and masking, these things that are going to be core no matter what phase we're in, and helping us, because this is what the failure is around the country, is the core things are failing. I mean, when you look at the pictures, it's failing because people are not physical distancing. They're not wearing masks. They're not paying attention. They're not doing what you're doing, which is amplifying the message of what we need to do to support our communities right now, and the risks to the most vulnerable of the populations if we don't take care of one another. So that's the core right now. And let's see how we can keep everybody focused there.
And I think that feeds well to our conversation about a social media campaign about masks that we can all participate in individually and collectively. As we move to phase 2, I think it'll be really important to, assuming that the application is approved, I think it's really important to remind people that moving to phase 2, moving to phase 3 doesn't mean we are done with social distancing, that we're done with wearing masks. The assumption is that as we move through these phases, that we continue those actions to slow and prevent the spread, and not to let people think that leaving phase 1 means we can leave all that behind. No, we take that with us, and continuing that messaging so that we don't have maxed out our hospital capacity, that we don't have issues this fall, we don't have a second wave, is all really important. Board Member Dembowski.
Thank you, Mr. Chair, and appreciate you having the meeting today. Patty, I send you my best wishes, and I'm glad to hear your voice. And we've kicked our town hall meeting to a later date to give us all a little more time, but I appreciated your willingness to do that, and you've been very publicly available and very responsive to the public. I may have missed it because I'm happy to say the sun is so nice here in Seattle. My phone overheated and shut down out here. And the debate, as I told Councilor McDermott, hasn't even gotten hot yet. But I wondered if you had a status report on the phase 2 application. We did submit it, and wondering if it's been approved or when you expect it might be. And then I want to echo Council or Board Health Chair McDermott's remarks about it going forward. Not only do we carry those practices forward, but it seems to me, and I'd like you to comment on this if you would, that what we've done here was an emergency response to an emergency that came on us in terms of shutting things down. But we have learned more, and we are bringing more resources online, and going forward, people are more aware. And so we have empowered folks individually, if they will help us and be on the team, to wear the masks and to stay home when they can, and to be aware of cross-contamination. And that we've got, really, if we can educate our community and population, more strategies on the table to combat this than the rough tools or the very, very blunt tools, I guess, that we had to bring forward, in my estimation, very quickly to stop the spread. in addition, it seems like we're getting some more therapies too that are coming online. So as I reflect on it, I don't think it's fair to apply today's knowledge and our increasingly aware population and the practices we are able to take collectively and individually in the community to the situation we had in March, right? That we didn't know as much then and we had to stop it then, but we can not only bring those strategies that we learned forward, but actually really even double and triple down on them so we don't have to go back to perhaps as draconian of measures as we had to implement in March. Thank you, Mr. Chair.
Thank you.
Yes, I think that all of that was really brilliantly said. I think it's all those things. When I look back at what we knew about COVID 3 or 4 months ago and what we know now, I'm grateful that we're starting to understand enough so that some treatment options are actually starting to surface. It'll be workable. As far as the phase 2 application, we're just waiting to hear back from the governor. I hope to have a positive response by tomorrow.
And my understanding is the county answered some questions from the governor's office or the Department of Health yesterday. And so with that further information, we hope for a response by tomorrow.
Correct.
All right. With that and seeing no further questions for Director Hayes, we move on to discussion and possible action on our agenda. Madam Clerk, will you please read item 7 into the record?
Thank you, Mr. Chair. Item 7 is resolution number 20-08, a resolution declaring racism as a public health crisis.
Thank you. To set some context for today's conversation on racism as a public health crisis, I'm grateful to welcome some leaders in the Public Health Department. They'll speak on work currently being done around addressing racism and by example, highlighting work around zero youth detention and its use of a public health approach and response. Following the presentation, the board members will have an opportunity to ask questions about this work, and then we'll have a briefing on the resolution declaring racism as a public health crisis and enter our deliberations. I'd like to welcome our 2 panelists, Matias Venezuela, the Equity Director for Public Health, Seattle and King County, and Derek Wheeler-Smith, the Director of Zero Youth Detention for Public Health, Seattle, King County. Mr. Venezuela, Mr. Wheeler-Smith, the line is yours.
Great. Thank you, Board of Health Chair Joe McDermott and board members. And I also want to especially thank our Black, Indigenous, people of color, communities and organizations, and especially the Black-led organizations, because I don't think we'd be getting to this point in this conversation without their and work. So this is, and last week I had an opportunity to talk to you about COVID and the work that we're doing with community. I think this is quite related, but I think it's really important to start by just saying we do have 2 crises at the moment. It's both racism and COVID-19, and one of these was with us already. I think it's really time for us to ask some hard questions. For example, why have we put so much attention, effort, and resources at COVID-19, and we haven't responded to racism with the same level of vigor? What role have we as institutions and as individuals played in perpetuating the injustices we have today? And why did it take a dizzying number of stories and images of killings of Black people to get us to this state? Supposedly by individuals who are supposed to be serving and protecting us. I think we are increasingly at a point of consensus, both locally and nationally, of condemnation and repudiation of the killing of Black individuals by police, including also the added trauma that this is causing, especially around Black communities. But in addition to these horrific acts of violence, in a more quiet, no less sinister way, we live in a system that is literally killing and suffocating Black and brown lives every single day. They're taking away years of life due to chronic disease, burying families in debt due to predatory lending practices and housing policies, and taking away the right to life and health for large portions of our population, especially Black and brown people and families, don't have access to the healthy environments and neighborhoods where we can all thrive. We must now all recognize the historically and currently King County has been complicit in maintaining and perpetuating structural racism. And as an institution, we must be a vital player in dismantling oppressive systems that are grounded in white supremacy. When we declared racism a public health crisis, our King County Executive Dow Constantine and our Director Hayes made important commitments. We said we will share power and resources and work on community-defined problems using community-driven solutions co-created by people most negatively impacted by racism. We committed to convening other jurisdictions and agencies across sectors and to establish shared and measurable accountability. Community leaders and organizations will be provided resources to co-create. We make these commitments because we know that together we can lay the foundation of a better, stronger community. So we have both acute public health issues and more chronic, often slower moving issues that are extremely harmful in terms of health and well-being for our community. Most immediately, our county executive, Dow Constantine, is looking very closely at the criminal legal system and law enforcement. In his own words, he has said, if we are going to transform the way our county views public safety, we must divest from the old system and reinvest in Black, Indigenous, and people of color communities who have been most harmed by systems rooted in oppression. We are in the midst of our budget process, and the executive has instructed us and his budget team to review the budget and to do so with an anti-racist lens, guided by input heard from community. King County must drive resources to where they are needed most, as indicated by those in these communities. And as we move into recovery from the pandemic, we cannot make the same mistakes made in 2009 following the Great Recession that systematically stripped household wealth and by association health from Black and brown communities. Racism as a public health crisis existed before COVID-19. Yet now, COVID-19 has forced us to think creatively and go further than ever before to reduce populations in our detention facilities. Yet, incarceration after COVID-19 will remain a public health issue. The executive has expressed his intent to work with council, the courts, the prosecutor to make these changes permanent. It's time for long-term impact change with immediate and long-term steps. In our history, we have developed the knowledge, the skills, and the community relationships to actually make this work possible today. We launched Equity and Social Justice back in 2008, where public health teamed up with the executive's office to launch this initiative. We passed an ordinance, which was passed by King County Council in 2010, making this equity and social justice law. We saw where we weren't making progress. So in 2016, in our ESG strategic plan, we explicitly were leading with racial equity and racial justice. And now, given how grave and some of these inequities continue to worsen, both the acute and the chronic, we are declaring racism as a public health crisis. We now have the frameworks. I think already some people have been mentioning these in terms of the public comment. Our determinants of equity, which are based on the social determinants of health, tell us that social, physical, and economic conditions for us is what make a difference whether we thrive or die early or are more likely to have disease. Our equity and social justice strategic plan drives us to invest upstream and where needs are greatest, invest in community partnerships and with transparent, accountable leadership. And with a public health approach, we can combine quantitative data with qualitative solutions, the voices of our communities to create long-term solutions. We know we can't do it alone, and we have to work across sectors in these efforts. It's government, it's community, it's education, it's business, philanthropy, but it first starts with community. I do want to raise up, because I think it models how we have to do this work, is, and I think staff, Susie Levy is going to share this with the board, is that we have received a letter from the Community Health Board Coalition, and leadership, John Wiesman and his staff at the state, plus Director Hayes and Dr. Jeff Duchin, we have been meeting with this coalition and responding and acting based on the recommendations and even demands that are being set by these organizations. They have laid out issues around, number one, they have three areas or three main points. It's supporting actionable race, ethnicity, and language data collection. So this is some of the things, for example, and thank you, Board Chair and Board of Health, for submitting your comment that is now changing how the state will, or potentially changing how the state will gather data and actually be able to disaggregate for race and ethnicity. But we're also doing more. We've actually created one of our dashboards is on race and ethnicity as well. We've been using, we often talk about quantitative data as just quantitative. I think the qualitative, the voice of community is extremely important in driving our actions, especially lifting up those who have less of a voice in our activities. So last week I did talk about how our community mitigation and recovery branch, as part of COVID response, has been lifting those to actually create some real-time changes to how our systems and policies have been working. And also in terms of our data reports, and we're also combining interviews and other data in terms of doing that. The second area of action has been, that was requested by the Health Board Coalition, is the established anti-racist health protocols. This is around COVID screening and testing, culturally appropriate services, including language access, promotion of community health worker models, and also having anti-racism training for healthcare providers. So there are a number of things that we're doing there. And I think also last week I covered around some of the language access team things that we've been doing, offering materials in up to 33 languages. It's a new bar that we're setting here for King County. Also, we've been using data to drive our strategy. So really already you've been talking about testing here, how we've used that by race and by geography, and working not only in geographic areas, but also with those trusted organizations like our community health clinics to really expand testing. We're also incorporating this into contract tracing, for example, and with a pilot where we're actually hiring from community, also teaming up with CMAR to really have the folks. This is not something that we can have a call center out of another country to do it. We need people who know our community and know what the challenges are and have to be on the front lines. Also with COVID, we've been able to address when we hear challenges in a real time again, when we hear challenges in terms of people being, and this is through our community navigators, that people are being released in terms of after testing positive and going back to their homes and not getting the indications that they need from the healthcare provider. So now we've been able to establish real communication and guidance to healthcare providers so they're actually able to provide more information to healthcare providers in culturally relevant ways, using interpreters when necessary, so those people don't go back and actually harm and infect folks in their community. And finally, point number 3 in their letter is around investing resources and building relationships. They talk about leaders from historically underrepresented communities really making up at least half of decision-making bodies and hiring community leaders as liaisons and to be part of our response. And we take this to heart. Even though we have a pandemic community advisory group that includes big players and big businesses, we have half of the representation on that group is made up of representatives from organizations and from sectors that often don't get included in these kinds of tables, and having that really be able to drive our decisions. And also we've been moving, for example, using these navigators. We have about 30 navigators that we've been using to reach specific communities. We're now going to be moving to a community health worker model as we try to support more effectively those who are in I&Q to be able to have the social and care support services that they need to be able to do their work. So that's just an example. I think it's just how we have to sit in on tables with community to actually just be answering and developing joint work plans and being able to say, okay, where are we making progress and where are we actually falling behind and not doing this? Next, I just want to highlight, I think, as an example of this and what it means to do this work with an anti-racist lens. I want to go now to my colleague and friend, Derek Wheeler-Smith. I think it's an excellent example of his work as we have moved youth detention, which has historically been a harmful punitive model and system, into a model that's based on a public health approach, where we're talking about rooted in community, building on the assets of the community, and looking at determinants of equity. So, Derek?
Matthias, thank you for that handoff, board chair and board of health, and everyone under the sound of my voice. Appreciate the opportunity to hold space for this conversation today. Actually, I would like to share my screen for folks to be able to look at and to be able to track for this important conversation. So I am 44 years old, and I had an anxiety attack for the first time a week ago. And that experience reminded me that the body keeps score. Generally, in these kinds of conversations, we genuflect to the comfort of dominant white culture. And so while we are having a profound conversation right now about race, I want to remind you that before race, this was really a species issue, one that said, as a Black man, I'm less than human, and that we attached race to a question of species. Neely Fuller says, if you don't understand white supremacy and racism, everything that you do understand will only confuse you. So when we ask, why do we have this huge gap in things like education or in terms of the disproportionality, when we think about juvenile detention, I would say that therein lies our answer. What I ask of you as I unpack this conversation is that you pay attention to your own body, that you recognize as I'm sharing where you feel resistance or tension, and that you take note of it, because there lies an opportunity for you to explore your healing around this conversation around race. So each of our sectors, when we think about it across the board, has a racially predictable mortality rate that ultimately leads to death. Some of them are what I would say slower than others. So the school system, I would say, is a slow death for Black and brown children, but gun violence, whether at the hands of a police officer or a perpetrator, is a fast death. And so it is the most pressing and urgent issue. We wouldn't pull up on a house, the fire department wouldn't pull up on a house that was on fire and say, I noticed that this house is out of code, but they would first put out the fire and then address the structural damage as well as whatever led to the fire. And I would say that gun violence is the entry point, but that we must keep our eyes on the big picture, which is the work of creating an environment that allows for equitable, both quality and quantity of life to exist by addressing the different social determinants of health. And so with zero youth detention and through a public health approach and addressing gun violence, we have work that's happening right now on the ground, and we are grappling and contending and holding the tension between what do we need to do to stop young people from dying tonight, while at the same time looking at how do we create an environment that allows for equitable quality and quantity of life to exist. And so I'm sure you're going, well, tell me more about that, Derek. What does that look like? Well, I think the first thing that we have had to grapple with and settle on is that when we talk about racism as a system, right, we're talking about disparities in one societal domain not being independent of those in other domains. And so what we then, understand as a result of that is that racism is really a set of dynamically related components of subsystems, and that disparities in one domain are a product of causal processes across multiple subsystems. So what that leaves us with is the reality that it is absolutely impossible to come up with remedies for disparities if we fail to acknowledge and address the interdependence across domains, which is why we have decided to take a regional approach to addressing gun violence. So declaring racism as a public health crisis, I think, is powerful. But now we must move to decolonize, as my colleague Matthias so eloquently stated, and divest from the past. We cannot tap into the ennobling possibilities of the future without divesting from the past. And so if we're honest, we aren't disrupting a school to prison pipeline as much as we are disrupting a business model. And so decolonizing our data means that we have to be willing to decenter this idea of whiteness. And so for the sake of this conversation, please note that when I speak to or of whiteness, I'm not so much talking about property of skin as much as I am a social power, right, that reproduces its dominance in both explicit and implicit ways. As you look at kind of this tree diagram that I've offered here, quantitative data alone is incomplete, as it leaves us focused solely on what can be counted and measured. Most often, I want to suggest to you that it leads us to address symptoms and not root causes. And so we are preparing right now, as we're declaring racism as a public health crisis, to do what hasn't been done, which means we will not be able to leverage technical solutions for adaptive problems. We need to pull in historical data, because without it, we are left with a deep sense of victim blaming. Historical data enables us to see trends over time and to build predictions for the future. And the knowledge that we're able to gain from the past gives us insight into the pathological stereotypes that have birthed racist policies, racist practices, and structures that are currently at play. Without historical and qualitative data, we are left to explain away and justify inequalities without proper context. Historical data should keep us from getting on the other side of situations only to acknowledge the fact that we just went through and experienced inequities and we hope to do better next time. What we know to be true is the importance of engaging in the research process in ways that affirms the cultures and context of the people who are being studied. And in the interest of improving service providing and economic and political initiatives, sometimes we emphasize the utilitarian practical value of research. And in doing so, we elevate quantitative data over qualitative data and deem the latter as deficient. I want to declare to you today that this kind of othering is deleterious to norming multiple perspectives and the idea that all perspectives are valid, but all perspectives are partial. And so if we allow one perspective to shape our learning, we will leave miseducated and misinformed from the space. And so we must normalize the social construction of multiple perspectives. And so it is important that that most often our data can lead to a disproportionate representation of the reality of the circumstances and conditions in society and a misdirection of resources to then solve real problems that exist among the people. And so we're left to address symptoms and not the root causes. Moving zero youth detention under public health was important because a public health approach requires analysis to examine why there is a difference between the desired state of health or social issues and what is happening now to solve it. So in the analogy of the tree that I'm offering you here on this diagram, the quantitative data that we often look at is really the forest. It's this look at the population. Qualitative data is really looking at the individual tree, right? Or the individual person. Public health acknowledges the importance of risk factors from individuals, but highlights that addressing factors at the societal or community level is actually what allows programs and interventions to have a greater reach. And so we have to then pull in historical data, which is really the roots of the tree. And then we have to be able to talk about dominant cultural values, which is the soil that feeds the roots of the tree that then impacts the forest as well as the individual trees that we're looking at. And so this idea then of decolonizing data and this approach that we're taking and looking at a comprehensive plan to addressing gun violence and the fact that we now have 19 different folks across different sectors who have all come together from the county and the city to develop capital alignment and a comprehensive plan to addressing gun violence. This is not just about how we tackle gun violence, but I believe that it is the blueprint for how we tackle the house that racism built. Community violence implicates both a public health and a public safety, which then requires the kind of multidisciplinary and multi-sector responses. But again, it requires that we deconstruct and decolonize the approaches and the ways that we have looked at data, and that as we move forward, that we recognize that we have to then begin to divest from these historical approaches that we've taken and then invest in these approaches that we know leads us into the future, that centers and creates a space of belonging that invites all people to the table and that says that we all belong. So thank you for the opportunity just to share with you in this space and to unpack the work that we are engaged in zero youth detention.
Thank you, Derek. And I will now hand that back to Board Chair Joe McDermott and want to also just thank the board for taking this important step to act as a board and also within your particular sectors.
The appreciation and thanks is to each of you for the presentation you've made to us today. Before we move into the resolution and debate and discuss the resolution, are there questions of Matthias or Derek? Then let
Mr. Chair.
Councilmember Dembowski.
Oh, thank you so much. If there are no questions, I don't have a question, but a comment. First, I want to thank the panelists for their excellent presentations. Super interesting and very helpful. And I just want to share with my colleagues, since it was framed a little bit for at least in an example form of looking at our Zero Youth Detention initiative, which I think is good. A few years ago, I took a run at when we were getting going on building our new youth jail at maybe looking at alternative paths. And to be candid, it was just probably too late in the process to make the outcomes that we hope for long term readily achievable. But in the course of that work, I did some work with Dr. Troupin and his colleagues at the University of Washington, as well as with Team Child, Annie Lee. And we put together, and it wasn't Dr. Troupin, but someone in his institute there, another doctor at the UW. We put together a draft model. I won't call it fully fleshed out, but it was them that put together a model of kind of a medically based, trauma-informed systems response to youth who we would otherwise put in secure detention. And we did not take any crimes or alleged crimes or violent conduct or any conduct off the table in responding to the young person in crisis. And I want to just surface that because I think maybe there wasn't maybe the time or political will or maybe even the learning at that time, but I think we are all becoming more informed. And I want to just flag it today and let you know that I will share that with you all as a document to just take a look at as we continue down this path, because I think there's some instructive options there that might help us do the work that I think we're all committed to doing. So I appreciate the opportunity, Mr. Chair, to just flag that and let folks know that I'd like to share it.
Thank you.
Thank you.
Don.
Yeah, I really appreciate the presentation. I had not seen that tree before. And I think the power of that tree is that as we think about how much our society thirsts for data, and yet the recognition that if we only look at the hard data and the numbers, we lose sight of the individual stories and the qualitative pieces that go into that. And so the thirst for data can be really exhausting if all we talk about is the quantitative measurable data versus losing sight of the fact that individual lived experience are equally important. So I want to really stress that, and I appreciate the tree. I'd love to get a copy of the tree because I think one of the challenges we have as we talk about racial equity and moving forward is that we lack the language, right? That as a society, we have not openly talked about racism and racial equity in quite this way. And so to the degree that we can have a set of common terminology, definition, and language and framework, it can help us with figuring out how to move forward from there with some common set of shared information. And hopefully, if we can lead with that, it leads to less misunderstandings as everyone engages in this work to learn and grow together to, as you talked about, right, the house, our whole society was built on institutional and systemic racism. It's all around us. It's in the air we breathe. And so how do we even get to a place where we can set a space where it's community-led solutions in a way that those that need to come with us actually are on the journey with us versus fighting with us? So I want to really appreciate that work. Thank you.
Good. If Derek wants to go first, that's fine.
Derek, did you want, please?
Yeah, I was just going to offer, thank you, that folks can go to kingcounty.gov /Zero Youth Detention. The tree is actually there, and it's a part of our data dashboard. And there's as well some thoughts there about how we can deconstruct and decolonize data. And welcome people to go there and to check that out there. But I can also send it to you separately. I also appreciate Councilman Dombowski and the thoughts around the intentional work that needs to happen to move, and that could actually get us closer to this idea of zero youth detention. We've got $1 million RFP that's actually set to go live tomorrow around community-based alternatives to detention. There's also some powerful thought partnership happening with community around how we can develop close to home facilities. We've seen models in New York where that is a 8%, less than 8% recidivism rate. And so why aren't we strategically looking at how we keep young people in community, provide the wrap around holistic services that sets them up well for life? I'd like to say that gets them back to rehabilitation, but in some cases, we're not rehabilitating because there was never a level of homeostasis to begin with. So we're actually habilitating some of these young people. And we are excited about the opportunity to be able to partner again with community to be able to do that work. I would love to see what you all put together. So I look forward to putting eyes on that. Thank you.
Thank you. Mr. Chair, might I just briefly reply? Thank you. I really appreciate that. And, you know, to use your analogy of the house on fire, I may have been showing up in the fire truck when really it requires the building code council to work on the system. And so it's exciting to be able to be a part of that, and takes a little more time, and just really appreciate your words of wisdom today. So thank you. I will get it to you.
Board Member Lambert.
Thank you, Mr. Chair. Well, lots of thoughts, but I'll run through them quickly. First of all, I would love in another meeting to hear more intricacies of decoupling. That seems like a really good avenue of study. And, you know, one of the things that we were inhibited by, number one, is a state law. You must have a juvenile detention center. So there's a state law that required it. And the second part was the one we had was a mess, and flooding and all kinds of things. But during the time it was being constructed, we very much changed what it looked like. It was going to have many, many more beds than what it currently has. It has a huge gym, a huge library. It has places where people can get counseling. So it was softened, and there are places there where, and you know, we can talk to judges about this, but unfortunately, DSHS does not take many kids over 14. And sometimes we get a child in the court system who nobody wants, and that in itself is terrifying. And the judges have said we had no other place to put them. So I think that we need to look at DSHS not taking 14 and above most of the time, and also where can we find safe spaces and use some of that facility. So I wanted to point out that we did implement spurs and cedars, which was revolutionary back then. And thank you, Mr. Dombowski, for partnering with me on that, because that was a huge lift, but it's turned out to be very successful. Thank you. Turned out to be very successful. And it wasn't easy to get that through. So I think as we look at it, rather than saying that building is a terrible building, to look and say, what can we use it for that is good? Because it has now been designed in a way where it is flexible. And I think some things can be done in there, like counseling, and there's a food bank, and there's a clothing bank, and lots of things, and community rooms that were purposely designed to get us to the place that 50 years from now, we won't have a building that's obsolete because we don't have kids in jail. But until that state law is changed, and I don't think people realize it had to be done by state law. Thank you, Mr. Chair. And maybe it's less than 50 years, I hope.
Thank you. Other comments? Other questions on the presentation? Board Member Lewis.
Thank you so much, Board Chairman McDermott. I just have a couple of comments. First, I do want to thank Derek and all the other presenters. And, you know, I've had the pleasure of seeing Derek in action at community passageways, circles, and really out there building community in extremely impactful ways. And I just want to thank you for your service more broadly, sir. In addition to taking the time here to talk to us, thank you for everything that you do. I just wanted to make a comment, Mr. Chairman, that it seems to me there's been a very long track record on this board, and I think this is consistent in expanding the scope of an area that, particularly under your leadership, this board has taken on in a bigger way, which is gun violence, and gun violence as a public health crisis that impacts all of us. And I think it's good that we have this moment to acknowledge that a big subcategory of that gun violence is the massive number of our Black and brown neighbors who find themselves the victims of excessive force from law enforcement officers up to and including gun violence from officers of the law. And I think that this resolution goes a long way in expanding the scope of something that we already, as a board, have taken on as something that we care a lot about, which is the public health nature of the proliferation of guns in our community, and acknowledging that certain institutions that we, in our respective roles, not only as board members here, but as council members of our various governments, have in the oversight of government-sanctioned institutions that engage in the use of firearms in their interactions with community members that in a lot of cases do lead to tragic loss of life under circumstances where it is clear public health or law enforcement interventions were warranted and should have been pursued. So I think that this is an extremely appropriate resolution. I am very enthusiastic in supporting it here today, and I look forward to working with everybody here as a board, but also as our respective council members in our jurisdictions to really make sure that we put action behind the words of this resolution, and I look forward to that work.
Thank you. Further questions or conversation with our panelists? Gentlemen, I want to thank you again for the work you do every day and for how well you related to us today with passion and conviction, made it come alive for us. Thank you. We'll now hear from Susie Levy, who will give us an overview of the resolution that's before us for consideration today. Susie?
Great, thank you. Thanks, board members. It's good to see you today, and thank you to Derek and Matthias. Today's resolution declares racism a public health crisis. Public Health Seattle King County Director Patty Hayes and King County Executive Dow Constantine declared racism a public health crisis. King County government and public health have a shared commitment to working in stronger and better resourced partnership with community organizations and leaders to disrupt and dismantle racism and protect the health and well-being of Black, Indigenous people, and people of color. At the June 10th special meeting of the King County Board of Health, Chair McDermott requested a resolution echoing this declaration of racism as a public health crisis. Proposed Resolution 2008 defines institutional racism, articulates racism as a public health crisis, recognizes the burden on Black and Indigenous people of color, and highlights the need to center those most impacted by racism to determine the solutions. The resolution articulates the board's commitments as follows. The board declares racism a public health crisis. The board supports King County and Public Health Seattle King County in the work to advance a public health approach in addressing institutional and systemic racism. The board commits to assessing, revising, and writing its guiding documents and its policies with a racial justice and equity lens, including the Board of Health Code and our annual work plan. And board members as individuals commit to ongoing work around race and equity, such as participating in racial equity training, engaging and being responsive to communities and residents impacted by racism, especially Black and Indigenous communities, as partners in identifying and implementing solutions, establishing an agreed upon understanding of racial equity principles, to work towards anti-racist policies and practices, and to serve as ambassadors of racial equity work. Thanks.
Thank you. Questions of Susie? Then to begin our discussion, I'd like to say a few words about my approach to the resolution. I believe that each of us, as members of this board, as elected officials in our local communities, as health professionals, as people living in this county and in this country, have important work to do to address racism in both institutional and systemic ways. The resolution before us makes a strong declaration that racism has a direct and negative impact on the health and well-being of King County residents, and that this board has a duty and a responsibility to address it. It declares support for the work of the Public Health Department and the approach to address institutional and systemic racism. The resolution also identifies specific action by this board and commits to center the work to end racism as our work moving forward. I think it's important to point out that uniquely, I would challenge us to expect and take this up as individual board members, not to expect the department to bring recommendations to us or for us to bring projects for the department to undertake, but for us as elected officials and health professionals to bring ideas to the board itself and to take up this work as board members and in our professional and personal roles throughout our communities. I think that's part of the statement we're making and part of the invitation and challenge I invite us to take up. And with that, I'd welcome conversation, comments and questions from our colleagues as we discuss the resolution before us.
Mr. Chair.
I've just been pointed out, Councilmember Lambert, if you'd hold for just a moment. Board Member DeLucky, would you move adoption of the resolution?
Yes, I'd love to. And first, I'd like to thank Matisse and Derek for two very powerful and informative presentations. And with those presentations in mind, I would like to move Resolution 20-08, a resolution declaring racism as a public health crisis before the King County Board of Health. And Mr. Chair, I accept your challenge.
I'll second that.
It's been moved and seconded. The chair has already spoken before it was moved. Other members are welcome to engage in the conversation and discussion. Board Member Don.
Yes, thank you. You know, I was reminded last night when I was at a different function that it's not enough just to stand with me, that we have to do something. And, you know, when I think about this resolution, it talks about the fact that we are all connected as a community. And by declaring it as racism as a public health crisis, we're acknowledging that our collective health and healthy communities are intertwined. And so my hope is that this is setting the intentions with words, but that we're going to have actions behind it. I appreciate that it talks about community-led solutions, because I do think that, you know, those that have historically been excluded from decision-making have to be centered in this work so that we're not working on solutions that don't get to the root causes of issues. One housekeeping item and then some comments. On line 53, it talks about the different Board of Healths that have also taken this on as a public health crisis. And I want to acknowledge that Pierce County just voted on this yesterday, I believe, and has declared that. So we should add them to the list. And I wonder that as we think about doing this work together, have we considered partnering with other boards of health like Pierce County? Because we are certainly not alone in this work. So that's one of the questions that I have. And then as we go forward and look at monitoring and holding ourselves accountable to doing this work, what might that look like? And so I appreciate the fact that it's going to be part of our work plan for this year, Chair McDermott. Is that going to be a whole board work, or would we consider actually creating a subcommittee that really hones in and works closely on this racism as a public health crisis? So I guess those are my thoughts about, I absolutely support the resolution. I just want to understand more broadly how we actually make the kind of impacts that we're talking about. Thanks.
Board members on. First of all, I would take as a, I would ask Board Member DeLucky, who moved it, if he would take as a friendly amendment adding Pierce County.
Absolutely.
And
actually, there was one more thing I want to add, and that is we talk about institutional and structural racism. And yet I think we also have to acknowledge that there are, we all have our individual racism and internalized racism and bias. And so my last question is, we talk about the structural and the institutional. Are we also going to address or help our community understand internalized racism and individual racism as well? Or was that intentionally separate?
Speaking for myself and my understanding, it would certainly be implicit in that and not intentionally left out. But as part of addressing systemic racism, that certainly doing that, individuals doing that work and having a more full understanding of their own personal participation in those systems and in racism and their own biases is vital to the work and can't be isolated. Regarding, I will speak. I welcome comments from Matthias or others, but to more further address your questions and your conversation, board members, on, we have, to my knowledge, we have not reached out or have firm visions of doing this work with other boards of health, though we certainly could. And to the degree we develop methods, programs, bodies of work that we can share or others have, or projects we can undertake jointly, whether it's with other communities in state or across the country, I would encourage that work. And then you also asked about a subcommittee and how this fit into the work plan. I could envision a subcommittee, but I would envision a subcommittee bringing specific projects and work back to the full board. I would not want to so set up a situation where the rest of the board might think that the subcommittee is handling it. I think it's imperative that we have broad joint ownership of this responsibility and not think that we have deputized or delegated this work to any subgroup, that it needs to be work we do entirely. And part of our conversation and our work, I would envision being about how are we doing this and how are we taking up this challenge and this work regularly at board meetings in a general sense, but also that each one of us, again, with individual responsibility, are using this statement, this lens, this body of work, this awareness to question, challenge, and engage with every other piece of work we do here at the Board of Health, that it permeates our work as a specific item on our work plan, but also a key part of how we do everything else on that work plan.
That makes sense to me. Maybe the same way that Director Hayes asked us about doing a little photo of wearing a mask, that we might also consider as a Board of Health doing something, a positive declaration that we all are all into racism as a public health crisis, whether we all stand with a little placard that says that or whatever that might look like. I think that would show solidarity in this work together. So I appreciate that. That makes sense to me.
Could be a really rich statement. Thank you.
Mr. Chair.
Board Member Lambert.
Thank you, Mr. Chair. So I too want to say thank you. And this was done really, really well. I enjoyed reading it. But there are two words I want to ask about. When I hear the word white supremacy, to me, that brings back ugly pictures of people with white uniforms on. And I'm wondering if a more appropriate word might be white privilege, because when you say privilege, that gets to the implicit biases, which was just what Councilmember Zahn was talking about. I think that when you say supremacy, it's like, okay, well, that's those people. But when you say privilege, it's more personalized. So I would like to have us think about whether that word supremacy should be changed to privilege. Because I feel like that word is more personalized, that it's my responsibility and everybody else's responsibility. So I throw that out as an idea. And then the second idea came up when the doctor was speaking earlier today from the UW and Harborview. He called this an emergency. And he used that word over and over. And it hit me that when you say emergency, that's the fire truck showing up and, everybody takes action now. When you say it's a crisis, we have a pandemic crisis and it could go on for a year or 2 years or 10 years or 15 years, who knows? But when you say an emergency, that kind of brings all hands on deck now. And I'm wondering two things. I'm wondering if the word wouldn't be better as emergency. And secondly, legally, if we say the word crisis, there's a public health crisis, does that give a future, and let's not even talk about this topic, let's say guns. If we declared guns a public health crisis, could some future public health director say anybody who owns a gun is a public health crisis, and so none of you can come out, you're all quarantined? Are we setting up that kind of a situation? Because we've never, that I know of, put a public health situation that wasn't disease related that you necessarily go to the doctor for. Obviously, we have a lot of changing and things we need to do for racism, but it's not a thing where it's contagious and everything else is contagious that we've declared a health risk. So legally, I'm not sure what this does. And so I just wanted to make sure that we're on firm foundation legally. But I really liked what the doctor said about it being an emergency. That to me contains such a more graphic, get on it and get it done kind of word. So those are my two thoughts.
We discussed the emergency versus crisis a bit last week on Monday, not last week, only Monday, at our special meeting, wherein we recognized that this is ongoing and systemic and deeply ingrained. It's not new, and therefore discussed, identifying the crisis and the need to respond to it, as opposed to perhaps labeling it as an emergency. I don't think I'm doing this explanation justice, but in a way that has suddenly cropped up. And this is far from that. There's also the legal reality that the Board of Health doesn't have the legal authority to declare an emergency like the executive or the health officer does. We have the legal authority to declare a crisis.
So what does that do legally as far as what privileges then does public health as, and not on this one, let's take it to guns, that for instance, in a future place, could they say, okay, anybody that owns a gun is quarantined? Is that the kind of power that we're giving? And I just want to know that so we know what we're doing.
I don't believe so. We are identifying a crisis, and our resolve to take up work to address the crisis and dismantle it piece by piece to the best of our ability.
So at some point,
but it does not create a new ability for the health officer or the executive or anyone else to take legal action that does not create a new ability.
Okay, great. And if there's any of our attorneys listening, I would like to get a legal opinion on that, just so that we're sure what that means. And then what about privilege?
Mr. Ruler-Smith?
Yeah, I would offer some thoughts about that. I think a couple of things. I don't know how many of you are familiar with Harry Potter, but I'm thinking about the fact that in the movie Harry Potter, you couldn't say Balgamore, right? And Balgamore, we all know, right, represented kind of the evil empire. And I think by not naming something, you actually give it more power. And so narrow definitions of the term and by not naming it for what it is actually helps to continue the work of the architects of the post-Jim Crow racial hierarchy. And so what we're talking about is creating a space of belonging. And we have to acknowledge, right, that the forefathers of this country, when they said we the people, they meant free land-owning white men, right? And so if we're going to deconstruct something different, it first has to start with our ability, one, to be able to name it, because most often what we have been socialized into is not naming the oppression that we're oftentimes experiencing. We're told, don't talk about politics, don't talk about money, don't talk about sex. Well, all three of those things are widely used to oppress people. And so if we can't talk about these things and name them from what they are, and if we can't even just talk about the fact of the idea when we talk about diversity, I want to ask you, what are we diversifying from? We're diversifying from white supremacy, which is rooted in anti-Blackness, right? And so we've got to be able to ground this conversation. And if we can't ground it and have an authentic starting place, then we can't really talk about what it's going to require of us to deconstruct it.
That was a pretty profound answer. Thank you.
Board Member Delecki and then Board Member Daniel.
Yeah, I was going to say in regard putting emergency/crisis into a medical perspective, an individual can go to the emergency room for a heart attack and have their immediate situation taken care of, but they're booted out of the hospital and yet they have multiple other issues that have to be dealt with. And to me, I view crisis as an ongoing process that is going to take some real thoroughness and a lot of collaboration to resolve. And I think of the drug crisis. It doesn't mean you can't continue to prescribe opioids. It just means that we need to look at other solutions besides opioids in dealing with patients. So I just would throw that up. And then also procedurally, I'd like to throw up, we had a friendly amendment, and I believe we have to vote on that too. Already.
To include Pierce County. All those in favor, please say aye.
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 Opposed, nay. The ayes have it. Thank you. Board Member Daniel.
Well, a few things. First off, I don't have an issue with the word crisis. I think that the words crisis and emergency don't preclude each other. Dr. Delecki pointed out very well where someone can have the crisis of long-term atherosclerosis, but the emergency of acute heart attack. It's not incompatible. Crisis means that we have long-term work to do, but there may be things that we can put on our plate to do that we can respond to more emergently. I want to speak against removing the word supremacy. The word privilege, power and privilege is already in the text. And I think without a statement about white supremacy, it's left vague and unstated, as Derek said, as if we're hiding from the issue about who has the power and privilege. Finally, what I'd like to say is that I support the resolution. I think it's a great start. But as Councilmember Zahn pointed out, unless it's coupled to action, this will be meaningless.
Board Member Daniel? Board Member Daniel, your audio and video are breaking up. Audio and video There we go.
Can you hear me okay now?
Yes, very well.
Okay. Well, I don't know if you heard what I said before, but I think that it's essential that we couple this to action. I'm not a big fan of subcommittees. Our subcommittees are notoriously slow. However, I do think subcommittee can serve the opportunity to discuss things between meetings and bring things to the board at the next meeting. Otherwise, we have no real structure to do that. I do think that we could be thinking in terms of shorter term and longer term approaches that we could consider. I do think a subcommittee would be valuable to do that so that people could actually bring back to the board something concrete by the next month as thinking towards a work plan. That's it for now.
Thank you. Further discussion? Board Member Dembowski.
Thank you, Mr. Chair, and I'm trying to reserve my spots to the end as an alternate, but I appreciate your willingness to hear from me.
Of course.
First, I want to say that I'm frankly quite emotional with today's discussion. It's very moving and deep. I was really proud to serve as chair of the board. I know Councilmember Colwells and you have both appreciated the opportunity to do it. It's a very important role and a privilege to be able to do it. And this board has worked on this for a number of years. We added to our work plan addressing disparities in health outcomes. And I thought that at the time was kind of revolutionary and important. And this is amazing that we're moving so far beyond that now to not just look at the results, but the causes of that. And it seems maybe obvious now and apparent that the cause in many cases of those disparate outcomes in health, including 10 years of life expectancy difference in our own county between an African-American person or someone, say anybody living in South King County and someone living in Bellevue, just 10 miles away is incredible. But to go to the root cause, which I think is increasingly becoming, if not obvious, apparent, that it's racism in our systems and structures in our community that drives that. Councilmember Lambert used the word contagious. I think some people looking at this might say, well, is this really something for the Board of Health to do? And I really that word caught my attention, Board Member Lambert, because I think racism is contagious. It is not something that we're born with. It is something that we acquire over the course of our lives from other people, right, and society. And therein, in that observation, I think lies the opportunity for this public health response. Public health can combat germs. We can combat behavioral health challenges. We can combat chemical dependency. There is no reason we cannot combat and take on and defeat the epidemic of racism, a contagious disease. And so with respect to the comments of Dr. Daniel, which I think are well taken about action, I think that is the next step. This is an acknowledging step. This is an awakening and making aware step. And then what's so great about public health is they go into action. They bring science to the table and best practices to the table and say, how do we combat this scourge? How do we stop the contagious scourge of racism? And I think it's actually pretty frickin' revolutionary. But when you think about it, it makes all the sense in the world. Councilmember McDermott, you did advance this board's work on gun safety. It has been a priority for you, as well as Councilmember Colwells and other members. A lot of people didn't think of gun violence as a public health issue. But you said, let's get the data. Let's look at the causes. Let's advance awareness and knowledge, right, from a public health perspective, and hopefully be able to bend that curve. So I don't think this is a feel-good statement at all. Not that that's been said, but some might say that, or that we're doing something to put something on paper. I think that this is represents all the best that public health and the approach that public health brings to solving our toughest challenges to bear. And I think will be incredibly powerful. So I'm excited about it. I know on important resolutions, it's not our general practice on stuff we were able to sign on as co-sponsors, and you are the lead on this, but I would certainly like to lend my name if you're open to that as a co-sponsor with you, Chair McDermott, in the resolution. And thank you and our health department for bringing this forward. I really appreciate it. Finally, just to end on a maybe emotional moment on the technical matter, I did, between our discussion earlier in this week and today, reach out to our legal counsel to say, hey, is there a difference with respect to our legal structures on emergency declaration versus versus this resolution. And I was told back from the lawyers there's no practical difference. There are no powers that are evoked or brought into bear by declaring the crisis of racism versus declaring an emergency. So I don't believe this is a diluted effort at all. And I believe it's up to us, as you pointed out, Chair McDermott, to all engage on an individual basis and a collective basis as a board, and then the power of the government. We've beat polio in our time. We're working on gun violence. There's no reason that with concerted effort with a public health lens, we can't beat racism. And I appreciate you bringing it forward. I'm excited to be a part of it. Thank you.
Thank you. Yeah, and by all means, would welcome your sponsorship of the resolution. And I think she wants to be called on too, but I think Cole Wells is indicating she'd like to be added as a co-sponsor. And I've also been reminded regarding the conversation we've had earlier about subcommittees. And while, as I said earlier, and I stand by the need for the board to own this and do so collectively, I've also been reminded that subcommittees are how we can make sure that our work is informed and in fact driven by the community as well, and not self-informed, but community informed. And so there is a value that I had not mentioned or had in mind at that moment about a subcommittee engaging in this work as well, is to make sure that we're working with, informed by, and have the voice of community grounded in work. The last thing we want to do is do this work without community. Board Member Cole-Wells.
Thank you, Mr. Chair. And it's hard to follow all the people who have already spoken so eloquently. But I absolutely would like to be a co-sponsor, and I would like to serve on a subcommittee if we indeed established. I also feel very emotional about this. It's been most of my life work has dealt with anti-discrimination issues, and in academia as well as a public policy maker and researcher. But I think this is critically important. I'm very gratified that the Board of Health, it appears, will be taking this stand, this position, and do so in an official policy. I am very sorry, though, that I am going to have to get off the phone any moment. I'm supposed to be leading a budget meeting right now, and but I thought this was critically important to stay engaged. But thank you, Mr. Chair, for bringing this forward.
Thank you. Other board members? Board members on.
Yes, I didn't want to speak again unless everyone else was done. I would like to, as I was listening to the conversation, make a second friendly amendment. And that is a sentence that Councilmember Lambert talked about. I'm wondering if we could add a couple of words to line number 13 that maintaining this, whereas by maintaining the status quo and existing systems of power and privilege based on our country's long history of white supremacy, because I think that, to the degree that we're really talking about this long history, and that's why we're naming it now, I think it's important. And so that would be my friendly amendment. And then to the degree that we decide to have a subcommittee, I would very much like to serve on that. And I agree that if it amplifies and speeds up our ability to work on this item versus actually seeing that as a subcommittee, that just means that the broader group isn't going to do that work. So my two comments.
Thank you. One of those comments was an amendment. On my line numbers are slightly different than the ones you all are using. I believe you said line 13.
Yes, line 13. So it appears to be the 1, 2, 3, the fifth whereas.
Yeah, I'm happy using your line numbers. Line number 13 privilege based on our country's long history of white supremacy. So inserting after on line 13, our country's long history of.
Correct.
Discussion? Seeing none, all those in favor, please say, Board Member DeLucky?
Yeah, I was wondering what Derek's opinion would be if that dilutes the intent of this resolution at all.
Mr. Wheeler-Smith?
Yes, I've got a 5-year-old here who's competing for my attention. Tell me, can you unpack for me a little bit more what you mean by which part specifically could dilute the resolution?
We are discussing on line 13 in the whereas that includes the term white supremacy. We are discussing adding in the line 13 privilege based on our country's long history of white supremacy. Adding our country's long history of.
So really acknowledging that this is not something new, that we have a long history of white supremacy in our country. And so, but I would defer to Mr. Wheeler-Smith if this would actually amplify the systemic nature of white supremacy, or if you think that it would actually weaken that sentence.
Yeah, I think that's tough. I think you're right? I think there are people who think that we're crying over George Floyd, but the fact is we still haven't gotten over Emmett Till. And so I think there's also a danger, though, with that sentence and the way that it could kind of read is almost like this is some historical thing that has somehow maybe for some people gone away, right? So while we have tons of racism going on in this country, we can't find a racist anywhere, right? And so, and part of that has been because of the way that it became this moral thing. And so it's difficult for us to talk about how racist ideas inhabit bodies, right, of all colors in terms of how it manifests itself. And so,
So could we maybe say long history and continual persistence of, because I think there's something there as I was listening to the previous speakers talk that I think it is not I agree with you, it's not a one or the other, it's both.
Yes.
And in thinking about how we name it, let's name both our country's long history and the continual persistence with.
Yeah, we were
or someone can come up with some better words than that.
I like that. We were built with a specific design, and how are we different today from that design? And I'm not saying that that's the language that needs to go in there. I'm just saying when we think about how we're showing up currently and holding space, right? Like, what's different?
All right. Board Member DeLucky?
Yes, I would like to move that specific language forward as a friendly amendment to the board members.
Inserting after, on line 13, after on, our country's long history of and continued persistence of. Discussion of on amending to insert that language?
Correct.
All those I've seen no discussion. All those in favor, please say aye.
Aye.
Aye. Aye.
Opposed,
Aye.
nay. The ayes have it. The amendment is adopted. Further discussion. Seeing no further discussion, I would ask the clerk to please call the roll.
Thank you, Mr. Chair. Board Member Cole-Wells.
Aye.
Board Member Lambert.
Aye.
Board Member Lewis.
Aye.
Board Member Morales. Board Member Morales. Board Member Morales. Board Member Mosqueda.
Aye.
Board Member Baker. Board Member Honda.
Aye.
Board Member Zahn.
Aye.
Board Member Daniel.
Aye.
Board Member DeLucky.
Aye.
Mr. Chair.
Aye.
Mr. Chair, the
Madam
vote-
Clerk,
Yes.
Board Member Morales said aye. She just couldn't be heard. She let me know.
Okay. I'll send her an email to verify that vote after the
Thank
meeting
you.
as well. You're welcome. Mr. Chair, the vote is 13 ayes and Board Member Baker excused.
Thank you very much. Having received the required majority, Resolution 2008 as amended is adopted. I remember the chair will send out an email and solicit people. I've taken names, but will solicit involvement in a subcommittee to work with community and support this work. But again, not at all in replacement of the entire board's collective and individual personal and professional investment in continuing and taking on this work. And secondly, remember that your photo of wearing a mask as a member of the Board of Health is due to my email inbox by 5 p.m. on Monday. So we can put together a board-wide social media campaign to augment the one that you will undertake yourself. And I need to say how incredibly proud I am of this board for the work we're doing today and what we have just done. Significant, valuable, and the first step in some significant work that I think will be challenging and hard and extremely worthwhile. Board members on?
Will we also consider doing the same social media with racism as a public health crisis?
Yes.
The same as the mask?
Yes, and you suggested something about a statement or visual that we could also share broadly.
Yeah, whether we all hold the same sign that says racism is a public health crisis and just get our photo taken and collect that as a collage.
Why don't I take on getting a document ready, emailed out to everybody that then you can print out in the comfort of your own home office, wherever that may be these days, and have a spouse, family member, or a timer on your iPhone take that photo for you, and also have it into my inbox. Board Member Mosqueda.
Thank you, Council President. Okay, let me try that again. Board
Joe.
Chair. Thank you for shepherding us through this conversation. And I know that for those who work in public health, we often talk about racism as a social determinant of health. And I think that this continues to drive home that evidence-based or data-driven analysis that type of stress and oppression causes physical trauma. So I think that this has been a helpful discussion to articulate that for the viewing public, but for us to codify it in this resolution has been incredibly important as well. There is ample evidence, physical evidence, that this type of trauma to the body and to life expectancy and health outcomes is really a byproduct of racism in our society. I also wanted to note Councilmember Morales would like to say something, and I think her line has been muted. So I don't know the technology of all this, but I wanted to flag that for you and just say thank you, and I appreciate it.
Madam Clerk, I'm looking for her. If you can find her.
I found her and I unmuted her.
There we go.
Hi, everyone. I'm sorry. I'm not sure how to unmute myself. I've tried a few different things and have been unsuccessful, so thank you. I need a little bit of clarity on what we've just voted on. If I might ask for that first, and then I would like to make a statement. So I thought we were voting on whether or not to create a subcommittee, but what I think I just heard was that we voted to actually adopt the amended resolution.
The latter is correct. We just voted to adopt the amended resolution.
And are we voting on a subcommittee?
No, the chair will create a subcommittee.
The chair has created a subcommittee. Okay. So thank you for that. I want to first of all, thank everybody for this really important conversation. We've been talking about this at the Seattle City Council a lot. The whole country has been talking about this, but we know very well that this country is founded on structures and systems that have oppressed people, and were really created to exclude people and continue this this kind of oppression. And so I'm having a hard time, I will say, with this debate because it, in my mind, is just so clear. We don't need to qualify this resolution. We don't need to, second guess what is so clearly been a problem in this country for hundreds of years. So I want to give just an example of what transpired in the last 2 hours, which is that as soon as there was a question about whether we should talk about racism, a person of color is asked to explain why this is important. That is structural racism. We have to acknowledge our own position, our own privilege, our own racism, whether we are, acting on that or not. We are operating in systems that, and have grown up in systems that that put us in this position. And so we have to be really proactive in dismantling it. And one of the first steps to that is acknowledging why it's important. And I know that is the complete intent behind this. But I just have to say that, it would not be my preference that this go to subcommittee. I think we should vote on this right now and then begin the work of figuring out how, as a board, we will continue to act on things as, Councilmember McDermott has done with issues around gun violence, as we've all done around issues with public health and education. So I am glad that we are doing this. I'm glad that we have this resolution that acknowledges. I also want to acknowledge and thank, Matthias and Derek and the communities you come from and the communities that you work with, because this is exhausting work. And to keep having to explain it, to keep having to push for our institutions to do the right thing is exhausting. So I want to acknowledge that too, and thank you for what you're doing. And with that, I am happy to get muted again.
We'll keep you from being muted for just a moment. I want to be clear. Perhaps I was not clear. We have adopted the resolution at the full Board of Health. We have not and we will not send it to a subcommittee. We have adopted it as the full board, and I am taking volunteers to serve on a subcommittee to continue and foster and promote further work, with also, I hope, a clear explanation, understanding, and wide agreement within the board that we are not relegating this resolution to one subcommittee to take on this work. Rather, it is work that we all must own individually and collectively. And in order to facilitate more conversation, work, and action at individual board meetings, there may be work in a subcommittee. But I do not want to characterize it as sending this to a subcommittee. So I want to be clear about my intention and work there. And then also, Board Member Morales, I've been asked by the clerk if you might verbally affirm your vote on the record.
Oh, thank you. Well, I appreciate the distinction, and I do think that is an important distinction. So thank you very much. And yes, I do vote aye on adopting the resolution.
Thank you. And the clerk thanks you as well.
Thank you.
Further comments before we adjourn? As I said, we have taken up a formal resolution today that is a step, a recognition, a declaration that will lead us to some challenging and engaging work. Part of that work for all of us, I would suggest, will be to recognize and observe tomorrow as Juneteenth. And with that, I want to thank everybody for the honesty, the passion, and the commitment that we've brought to the Board of Health and this topic. And I look forward to seeing you all virtually at our regular meeting in July, if not at a special meeting before then. Thank you so much. We are adjourned.